All right, welcome guys. Okay, welcome. Good afternoon to you all. Good afternoon, good evening, good morning to our many viewers. This is COVID-19 chat on the TUI Health Job. On to this edition of the COVID-19 chat on the TUI Health Job, we have invited the following personalities to discuss COVID-19 in the country. Mr. Jean S. Momo Jr. He investigates cases on COVID-19 response team at MOH. And Mr. Joseph Charles is a scientific and technical review panelist to the Ramsar Convention from Liberia. And Mr. Forkpa Pewee is a health promotion and education specialist and the CEO of Forkpa Pewee Education Foundation. The trio will give their professional opinion on COVID-19 according to their respective operations and field. These are all packaged on Zoom Cloud, and we are now streaming on our Facebook page and our other social media pages. So you can follow, share, and we own no copyrights to these songs. So gentlemen, we want to say welcome to today's edition of COVID-19 chat.
Thank you very much for the invitation. I think it is an honor.
Okay.
Thank you so much, Mr. Krua, for such an invitation. I'm so delighted to be a part of today's edition.
I think I would like to say thank you again for having me on this platform, because it's something great to actually share your experiences.
All right, thank you guys. All right, my name is Luke Krua. I'm your presenter. on this edition. So guys, to begin with, Liberia is in a crisis, or the entire world is in a crisis. Now we have over 200 cases, with more deaths reported from home and fewer from health facility and the treatment unit. So what about the current crisis that worries you the most? And then what gives you the most hope? So we start with Mr. Momo.
What about the current crisis that worries me the most? That's a great question. Actually, looking at Liberia, which is a low-income country, what worries me the most is that we've had experience with Ebola, but I don't think that the experience we've had with Ebola have actually taught many Nigerians lessons because personally there's still form of denial and resistance towards this COVID-19. That is one of my greatest worries because as long as people can deny the fact that COVID is in Liberia, it is a serious worry to open up to this particular response. So, but the hope, actually, we're still hoping to see, but actually for now, the only hope I have is that the people of Liberia will be able to see that this thing is serious and this particular COVID-19 exists in Liberia. That's where my hope lies now. Because if they can actually realize that, then it means that the world can be
All right, thank you.
solved.
Mr. Chas.
Thank you so much. I want to comment on my previous speaker for such a good point. What worries me most about the present COVID-19 crisis that the entire world is facing, and narrowing it down to my country, Liberia, is the fertility rate. Given our last update, the National Public Health Institute of Liberia, taking it at if the mortality and the fertility rate, the mortality rate is my major worry. You see, we have more than 20 deaths at this stage, and we have more than 200 infections, people that already contracted the virus. Looking at other countries in the region, I mean, our country should be the second, second countries in Africa reporting high death rate. I mean, we have more than 8.5%. The people who are contracting the virus, are actually dying from the virus. So it's something, that's really battling, and I'm worried every day what's going to happen if all of our mechanisms that the national government is putting in place and all of the efforts from our international partners, we may likely collapse if we don't take this thing very seriously. What also worries me is our behavior as Liberians. I mean, people still have this belief that COVID-19 does not exist, that government is trying to our attitude toward accepting that the virus is in the country. I mean, people still don't believe in the health protocols are not being 100% observed. For instance, I work with the EP of Liberia, and we are part of the national response to the COVID-19 crisis. So we fly drone in this COVID crisis after the 2 o'clock curfew that was imposed by the government. And we see that there is still congestion of communities. I mean, beyond the normal, freeway we see, like the Boulevard, SKD Boulevard out in the way, and then coming to town. If you check in various communities from our imagery from the drone, it shows that people are still gathering in large numbers after 3 p.m. I mean, these kind of activities, I'm sure, are contributing to more people contracting the virus, and people are now adhering to the health protocols that the Ministry of Health and the national government as a whole, has installed. So it's kind of something that's worrying me. Now people are now accepting the fact that COVID-19 exists and is in Liberia. And lastly, this is very minute but also important, is that the mask. The government said the president in his second to the last empowerment of the curfew, he said all persons coming outside of their home for important businesses must wear mask. I mean, you still see sometimes 3 out of 7 persons are still moving, planting the streets of Liberia without masks. I mean, if you try to confront them about the issue, people say, "Oh, it's my health," and leave the way, man. This thing that play tactics by the government. They want e-money and the rest of it. So it's something that worries me. As a Liberian, and I mean as a health professional and somebody who is also fighting the virus, because I fought Ebola. I know how Ebola took over this country, and now I'm fighting COVID-19 and seeing how COVID-19 is taking over gradually, despite our efforts as government. But there is still hope. My hope in this entire process lies, in the area that testing. Liberia was able to get on par with other nations in the region with respect to testing. We are now testing and testing and testing. We are testing, testing, isolating. I mean, so that means we have the capacity to test. And I mean, one other thing is giving me hope is that the public stigmatization is reducing, because our people are becoming more mature and are becoming more professional in the kind of work they do at the various testing centers and various laboratories. That means patients' information are now being concealed. Okay, so people wouldn't know that people are getting infected. The names are not being mentioned. So you see, more people are stepping forward and doing voluntary testing. So this is helping to isolate the infected people out of the general population. That that is helping to curtail. That will help to curtail this virus if we continue on this path. And I mean, another hope is that, I mean, Liberians, the national government and our partners, they are resilient people. People are trying to put their hands together now to contribute. You see, people are out of their own way, out of their own pocket, they are donating assorted materials like washing hand soap, buckets, Clorox, and the rest of it. And various communities are, coming up with their own programs, making it compulsory to wash your hands before you pass or before you get out of the community. This is something that gives me hope. And I think that if we continue on this path, very soon Liberia might kick COVID-19 out.
All
Thank you
right.
so much.
Thank you very much. Mr. Pewee.
Yeah, thank you very much. The first thing that I'm worried over is the economy of Liberia. All of us are aware that even before this COVID-19 could surface in Liberia, we already had a struggling economy. We had a series of challenging issues to be resolved before this identical virus could hit Liberia. So that's my first worry. The rejuvenation of the economy after this COVID virus has actually gone away. The next thing is the involvement of too many politics and political actors in the COVID-19 response. As far as I'm concerned, from a public health perspective, during health threats emergency, involving too many politics into the fight can lead to a series of catastrophe. The fact remains that when we listen to various radio stations of recent, there are a series of internal fight, among our people, from the media to information ministry and other places. I mean, too many people like discussing and having issues and having conflicting things to talk about. So, I mean, that is my second major worry. The aspect of involving too much politics and political actors into the response. This is not healthy for the fight against COVID-19 in the Republic of Liberia. If we actually want for this thing to be out of this place in the soonest possible time. My next fear is the denial from the people. I mean, a lot of people still do not believe that the virus exists in Liberia? Well, some of them have personal reasons for which they think that the virus doesn't exist, probably due to some inconsistency in the information being provided by health authority, based on their own traditional belief or their own way of thinking. However, we are still doing our best to continue to provide the necessary information that are okay for our people to absorb so that they can be able to have the first thought that it is for their own safety. And, let them just believe that the virus exists and take all precautionary measures in making sure that we get this thing out of Liberia in the soonest possible time. And now, my faith that I have in Liberians, or my hope that I have currently, is that Liberians are resilient people. And because of the resilience they have built over the years from our interactions with the 14 years of civil crisis to the Ebola virus disease epidemic, it is obvious that Liberians are people who have built up that resilience over the years. And during this time, I'm very, very hopeful that in time to come, people are going to realize that this thing is real, it is killing people, they shouldn't take it for granted, and we're going to have that huge resilience all across Liberia, and our people are going to get out of this very, very soon by the grace of God. So that's my view when it comes to the aspect of my worry and hope.
All right, thank you very much, guys. Okay, so let's go over to Mr. Momo. So let's come to this process of investigation, case investigation, how is it done? So what is the process that lead to testing for COVID-19?
Okay. So actually, as a case investigator, we have a lot of responsibilities at this moment that we actually a bit of backdrop of as to how I started and then where I am today. So I was an investigator for the Central Monitor team. So because they had a lot of cases coming in the Central Monitor belt. So our key responsibilities are then were to actually track down and try to investigate both suspected, mostly suspected and probable cases, in trying to see as to who are those we have come in contact with, and we can see as to how best we can do line listing to actually reduce or stop the transmission, the infection transmission. And so that also what we do after that is that we then try to refer whosoever, for example, if we get to a scene in the particular case, it's their case, we investigate the contact on the scene out of the relatives that is there, trying to know their full details, their medical background. That's the first thing we try to see in it, and some historical or background in regards to the movement, and or looking at our own case definition to see as to whether that particular individual met the criteria of the case definition. So that's one thing we do. So after that is done, we then call on the specimen team. The specimen team is fully responsible. If the person meets the criteria, meaning a suspected case, the specimen team comes on board to collect the specimen and then send to the lab for testing. So if it's positive, that is not within my reach, but I believe that the psychosocial counselor or person is responsible to handle that in terms of disseminating such information. So that's exactly what we into. But currently, I am at the CHATMay Testing Center. So this is where usually voluntary cases are coming to do their testing. So we collect their specimens and then send. So that's exactly our key role for which we are doing this particular time.
So how is the flow of people? How are people pulling in for testing?
Okay, that's a good one. Actually, just opened recently, I think a week ago, around the 7th, that center was just open. Actually, I must commend the government with the fact that they have realized that there's a need to decentralize the specimen collection center, because first it was actually a SKD, but now we have CHATMay High, and we also have a Gibson So we've seen that, there are a lot of centers now. So when there are a lot of centers being decentralized, it means that we expect more people now to actually start to find their way in. But where I am, it has just been a week, but the flow is so small. But at least there are a lot of people coming voluntarily to do their test, which I must commend them for that.
Okay. So
So it's not that much.
okay. Thank you very much. So we cross over to Mr. Joseph's chat. So what do you think is responsible for the many deaths in the community other than the health facilities or the treatment unit? What do you think is responsible?
I may not be able to ascertain that fact right now because I'm not a case investigator or case management team member of the COVID-19 national response. I belong to the WASH pillows. The WASH pillow, the IMS, the incident management system of Liberia has zero pillows in this COVID-19. So I'm the WASH, the water sanitation and hygiene pillow, where my duties are, working with all of relevant land ministries and agencies such as the WASH Commission, the National Public Health Institute, Ministry of Internal Affairs, Ministry of Education, the EPA, and other civil society organizations to develop protocols. For example, what we do is to pick up barleys. We've got their barley management as part of our pillow, okay? So DBN, what we do in DBN, if a person's died within a treatment unit or someone died within the community, so we go, we got a team, make sure specimen is collected and taken to the lab to see if that person died from COVID-19 or not before, burial authorization is given to the family. If the person dies within a treatment unit, we have developed a protocol that the team is using to be able to, bury that person in a dignified manner. So we develop that protocol, and then the waste management, because this is very important.
Yeah, and we're going to
COVID-19
come to that.
response. Okay, we are also on the waste management pillow, so we are ensuring that waste management is not disturbed. It's done in a way that will not affect the health workers, will not affect the community, and also not intend affect the environment. That's why the EPA is very key on the waste management pillow. So since we talk about that, I will not dample deep into that. So hygiene, like hand washing in public facilities, ensuring that every public institution is implementing the law of washing hands continuously. So supermarkets will work with them. I mean, we do that oversight responsibility of the whole sanitation and hygiene aspect of the COVID-19. So that's the period I'm in. So, but with the death, I cannot ascertain, what is the cause of the high death rate, from a scientific standpoint. Okay, but I think in a region, from a personal perspective, in a region, we are having more death and we are reporting more death than the other region because we are testing people who were not in treatment unit. For example, if a person dies in the community, okay, like let's say for example, community X, but he or she was not on any treatment or any surveillance of COVID-19. So it has become a national law that the COVID-19 team must test that person to know whether the person got COVID or not. So we've been able to pick up, few deaths from those kind of scenario and add it to our death list. But which other countries in the region are not doing. So I think that could also contribute to the high death rate that we are recording at this stage. But in the treatment unit, the underlying factors would be maybe the person health status. Like we know, the person might have some other underlying health conditions like diabetes, HIV. They might have sugar and the rest of it. If you already have those underlying health conditions, you don't have a good immune system. The virus might beat you, and you might likely not survive it because there's no specific treatment right now, as we learned. Because what happens is that the treatment is symptomatic. If you are showing symptom of cough, they treat you for cough. If you are showing symptom of headache, they treat you for headache. If you're having fever, they treat you for fever. If you're having shortness of breath, they open your airway and the rest of it. So the medical doctors know how they're doing that. So you see, if it's based on your own attitude towards how you take care of yourself. So I think it's very important. That's why we have the public health experts here who might likely throw light on people taking care of their own food. The nutrition is very, very important in that light. So we are just working on the wash pillow.
All right. Thank you very much. So we cross again over to Mr. Momo. So what do you think? What's your own perspective about that? What do you think responsible for the lot of death we have recorded so far from communities?
Community. I think in my own perspective, I would actually like to the key reason why there are a lot of deaths from that point is the issue of fear. Fear is one. Fear now has actually taken over many people in Liberia. So people seeking medical assistance in health facilities are becoming a serious issue. So there might be some underlying of pre-existing or factors or diseases that one or might have, but because of fear and not trying to be stigmatized by going to hospitals and saying that okay, this person is a COVID-19 patient, and they decide to actually like stop medication, and which is not much okay in terms of treating them to an extent. So I believe that if you not get the best medication, it means that you are compromising your immune system to an extent. So we will have a lot of deaths that when they go to do the testing and it comes positive, it's just like you have a disease in line with how they call it, with COVID-19, it creates more complications. So I believe from my own that has been one of the issues of building or community death in relation to COVID-19. Maybe for what people will ask further, but that's exactly what I think for now.
Okay. So, Mr. Pewee, we are looking at what really responsible for the many deaths we have recorded so far in the community, other than the treatment facilities or other health facilities around.
Well, that is something that I won't be able to respond to efficiently because I'm not the one doing the testing. And a lot of people who died already, the team goes there to do the testing and come out and say the person is positive. Now, one of Liberia's renowned scientists, Dr. Douglas Yam, he straightly stated that their bodies, people who have died already, their bodies report should not be included into the COVID and death. Whatever the case is, health authorities are still going ahead to include people who died from the community. I mean, whether they take the sample immediately or after certain hours, the fact is that a lot of people who have been recorded as COVID death in Liberia, those people died before they can even be recognized. So now, if that is the case, it means that Liberia is on a serious time bomb. Because if people are dying from the COVID-19 from rural communities and not at the treatment unit, it means that the virus has spread beyond control. Now, and this is frightening, and this has deepened to the extent that, I mean, on several occasions, you will realize that the testing that our people are actually doing currently, not many people, who are at the center, the treatment unit, actually died from the virus. Now, according to our medical doctors and nurses who are assigned at the 14 Military Hospital, they are making us understand that the recovery rate at the 14 Military Hospital is high, which I think is okay. Which I think is okay. It's a sign of hope. But the frightening aspect is where they are testing dead bodies and confirming them as COVID positive. So that means that the virus is in the community a lot. And people have to do massive testing because the partial lockdown that has gone on here is not effective. Let me just say it clear. It's not effective. It's not very, very effective. And the health promotion and risk communication has very huge gap. The health promotion is not effective. The risk communication is not effective. There is a very huge gap. I mean, you see recently the media fighting Ministry of Information, because Ministry of Information is the one that says over the health promotion and risk communication area, where specialists like us who have the technical know-how, the skills and knowledge, and the requisite experience in using the IC strategies to effectively respond to these kind of public health threats. We've been left out of that pillow. You understand what I'm saying? So now, the media is fighting the information ministry, and then you notice that the issue of health promotion has gone down because the media wants to resolve an issue with the health ministry. So of recently, I've been battling this thing from one end to another, which is very sad for us in this country, which is very, very sad. So now, these things are bad because our people have to be informed about the danger of this virus. Our people must be informed to take the necessary preventive measures, which a lot of communities are doing. People are washing their hands, and all of that. The communities, the people are doing their best. Yeah, but when it comes to testing of, bodies and coming out to say they are positive, I don't really know. But that is something that our people who are part of the case management team or the people who are part of the laboratory team can better explain.
Well, it sounded like you have doubts.
There is when it comes to the entire fight right now in Liberia, I have very huge doubt. I have a very huge doubt. And it is not something that is personal. This is about the lives of more than 4.5 million people. When you risk the life of more than 4.5 million people for political reasons, it becomes very dangerous. It becomes very, very dangerous. You seen it?
All right, so we will come back to you. So let's cross over to Mr. Chat. Joseph, we have witnessed lockdown in many countries, many industrial countries like China, Italy, and other places around. And even our country, Liberia, we are currently on a lockdown. You guys are already in. So what I want to know is how is COVID-19 impacting our environment personally, especially when it comes to the global pollution?
Thank you so much. Thank you so very much. With that, I need scientific evidence. I may not speak for the global perspective, but I must speak from national perspective because I've been conducting a lot of monitoring visits with respect to air quality, with respect to water quality, soil sampling, and other environmental media in Liberia. And I realized that CO concentration, CO2 concentration in places that have been conducting our studies are drastically reducing. And of course, we know that the reason is that the movement is limited. People are driving their cars for less than 6 hours a day. So there's not much traffic flow, and most of the factories don't operate after 3 o'clock. Supermarkets, stores, and other big businesses are all cut off after 3 o'clock. So most of them use energy. And the energy, they are not using clean energy, they are on biodiesel, okay? So most of their machineries are down at that time. So we have noticed this. And with respect to water quality, places where we expect to see more of contaminants with respect to maybe pH levels going high up, maybe calcium, cadmium, and other heavy metals. I think we see that they are reducing, like below 0.01% of them are coming down. Okay, so that's also an improvement that we've noticed over a few months since COVID-19 in our country. So I cannot conclude for the rest of the world, but using inductive and deductive reasoning, I can use this case to conclude for the parameter of the people around me, like the West African region, places where also this kind of lockdown is ongoing. I'm sure that data from those places will show that there have been a little bit of reduction in their contaminants. Okay, so but I know of global temperature rise. The global temperature rise, it had not shown significant difference between when there was no COVID and COVID, because we have not anthropogenic impacts this time, but we have natural impacts. Okay, there are also natural impacts because of heat waves, because of of hard sunlight and the rest of it. Even rainfall is projected to be a little heavy this year because these are underlying conditions the earth already have. But we hope that this will improve the earth, because even biodiversity regeneration, there have been improvements, because there are some projects, there are some places that we've gone and we realize that places that never used to have vegetation are doing well there now, because people are not really encroaching the forest as they used to encroach it before. Even though they are still there, but encroachment levels are reduced a little bit. So we see that more trees are having good leaves, and I mean some species are trying to burst up. We may not see the impact at a very large scale at this point in time, but because it's going to be done over a period of time, maybe 10, 15 years, or even a year from now, if we continue in this lockdown, we will start seeing significant impact. Impacts are there, but they are not at significant levels at this stage. But I think it's a point where the war is trying to rest. I call it a resting time for the F. Mother F needs to take her bath. She needs to freshen up. So right now the F is freshening up. Even with waste, waste management is something that is not really curtailed in this whole COVID-19. Even though you say you have a specific question, but waste management is also a big issue right now in how we fight COVID-19 in this country, because we see that everybody using the surgical gloves, everybody using the face mask, the face shield. Some people even wear the gown that people use in infectious units, and some people will using it as a raincoat. And how to throw them away becomes something that authorities are also concerned about. And our normal way of life, we generate waste at our household level. COVID-19 has also impacted the lives of those people who come into our homes to pick our garbages, to take them at various holding centers around the country. I mean, if the guys used to come 2, 3 times a week, they will come once a week. And people would be careless about how they pile up their waste, and you see that the waste will just be in the house, and in the house, the guy can come to take it down. So because even the company that is operating cannot afford, bringing their workers outside, probably they don't have the pass to be outside after 3 p.m. Okay, so it's also impacting us in that area negatively. Okay, so
So
that's something I can say about that with respect.
so it means Mother Earth is actually benefiting at the expense of COVID-19.
Yes, for now. Even oceans are becoming cleaner and green and blue and the rest of it. So don't be surprised that because you go on the beaches now, if you have access like me, you go there around 4, 5, 6, 7 p.m. You realize that the beach is quiet. Whereas come and sit and have fun and they're flying away. So there's complete regeneration going on right now in the earth. Only problem is that the dispersal mechanisms, the wiping away of the third layer of the earth, whatever we put on the earth, what we are about to get in the rainy season. So if we use the face mask, we throw it down, we throw out the gloves, we throw it down, we use a face shield, we throw it down, everything will end up in our rivers, in our streams, and eventually into the ocean. So that's somewhere too again, it might come to affect us, okay? And these things will stay there for millions of years.
Okay,
So
okay.
we must pay attention to how we manage it at a community level.
All right. Thank you very much. So before we cross over to Mr. Pewee, James, could you quickly take this question? Why is staying at home and social distancing important, even for groups who are who are not at high risks?
I think that the best example is that it saves your life and also the next person. That's how short it is to answer that question. Social distancing by itself, try it helps you. You know, there are so many ways now we all trying to fight this. So individually, the best way we can save ourselves and the lives of our families is to stay home when necessary and also to avoid social distancing. So it's just for our own safety because like it is said that staying home
Mhm.
actually protects you 100%,
Sure.
especially when not coming in contact with anybody. So I think if I want to be protected 100%, I must stay home.
Yeah, that's
So I
yeah,
think
that's I
that's the
think
best thing to watch.
yeah, I think that's the same thing too. Like we have been in for over let's say nearly 5 months, and we are 100% safe because
Okay.
we don't have any contact with anyone and stuff like that. So I think social distancing is the key. It's the only medicine
Mhm.
or the only treatment I see for COVID-19. Okay, so now to Mr. Pewee. In recent time, you started a campaign named COVID-19 Diary Series on It Was Network. So tell us about this.
Yeah, sure. Well, basically, the COVID-19 Diet series on It Was Network is actually meant to educate our people on healthy eating practices during this COVID-19 period and to be able to tell our people on the threshold of the various classes of nutrients to be consumed on a daily basis relative to the recommended daily allowance, and by extension, discussing issues surrounding the treatment from Madagascar, which will be discussed this coming Friday, and looking at some of the key reasons why the COVID diet might not work for everyone, because from the onset, even up to current, all of the patients are eating the same food. I mean, the same food prepared from the same hotel. They are consuming the same diet. So now, which is not proper for me to think on something that is feasible. It is far better if you give certain people personalized nutrition or personalized diet. That is people with pre-existing conditions, people who have diabetes, people who have high blood pressure, people who have kidney disease. These people should have personalized diet. The reason here is that there are certain quantity of substances or minerals uh, that they should not eat in excess. So once they consume them in excess, it is very, very dangerous for their health and well-being. And during this period, proper nutrition and hydration, there are two important things to be strictly practiced by our people, because when you drink a lot of water, which is approximately 6 liters of water per day, it becomes okay to keep the body hydrated and to ward off some toxins that we found that are found in the body. And it is also not advisable to drink too much water during this period, because when you drink too much water, it might lead to over hydration. And what might happen is that you will be getting rid of those significant electrolytes that should help to keep the body in balance and proper maintenance during this entire time and beyond. So, I mean, proper nutrition during this period is key. It is highly recommended for our people. It is something that our people have to take into consideration, because neglecting proper nutrition during this period is something that is dangerous. Now, the virus is fighter to some extent. That is, when it attacks you, it makes the body weak. And once you are not eating properly, when it weakens your body, there is a possibility that will knock you off because you're not eating the proper diet, or the immune system is not built up. So because of that, it is advisable for our people to eat healthy and to make sure that they drink a lot of water. Because in some of the patients, because there are three categories. There are people who will develop, who have the virus and develop no symptoms. And there are another group of people who will develop the virus and have mild symptoms. And there are another group of people who will have the virus and develop severe symptoms. So now, these categories of people, if these people are not eating healthy, if these people are not drinking a lot of water, if the kind of food they are eating, they are not meant to be immune system boosters, then it means that a lot of people will die from this virus. Because once someone has a virus and the person is hungry, the virus can easily overcome that person. So that's why proper nutrition is important during this period. That is one of the key reasons why I've decided to bring forth this COVID diet series on Eat Wise Network to educate our people on it, because a lot of people in Liberia do not know anything about healthy eating. A lot of our people do not know anything about healthy eating. That is a fact. They overcook the vegetables. They don't even eat a lot of fruits and vegetables. They don't know the recommended amount of fruits and vegetables to consume. They don't know the recommended amount of the grams of salt to consume on a daily basis. They don't know the amount of sugar to be consumed on a daily basis. They don't know those things to eat that will help to boost the immune system. And you know, once I encountered a guy, a street peddler who sells drugs in the street. He was telling the people to buy his antibiotics. It will build an immune system. Where in this world have you seen antibiotic building the immune system of people? So that's the kind of ignorance our people have bought and that's a kind of unsophisticated thing that we are experiencing currently in Liberia. And then people are carried away by these things. Antibiotics do not fight against viruses. Only antiviral medications or prescribed treatment that come from medical doctors during the treatment period. So nutrition is key. It is important during this period.
All right, thank you. So are you thinking of suggesting some of the best diet practices to MOH?
Yeah, obviously that is something that I have all those things in my book. I mean, when it comes to healthy eating practices, on my first book that I wrote, the health benefits of fruits and vegetables in Liberian cuisine. We have all of those things. Dr. Fala bought 2 copies of my book. The acting director general at the National Public Health Institute of Liberia. I also work with him on a research team. That is not part of the response that is under the National Public Health Institute of Liberia. So we are currently conducting series of research work. We're going to be doing survey across the country on different research topics that are directly linked to this COVID. So our people have some of the information, not all. Like this going Friday, I discussed on the key reasons why the COVID diet might not work on some of the patients. So the video is there. A lot of people have gone there. Some people have called me, told me, "Oh, thank you. It is educative. It is a great venture. I mean, keep it up." So now, this is something that we are going to be discussing on various radio stations. Our people are going to listen. Dr. Fala has a copy of my book with him, and this is something that I continue to discuss with the people. Yeah, like I said, it is important for some of us to be on a response. It is important because of the vast knowledge that we have when it comes to, I mean, engaging these kind of public health threats. I mean, we're talking about robust engagement, not like, I mean, political engagement. Yeah, because when it comes to public health engagements relative to the use of the IC strategies in tactically tackling these kind of public health threats, they have different ways to do them. You use models, you use public health models to handle these things. A lot of countries are using specified models, and they are using great containment strategies. That's the reason why some of these countries are doing excellently well. Like Ghana is doing excellently well. They have great containment strategies because they believe in their scientists, their health workers. You see, they're not politicizing anything. So now, this thing, this thing when it comes to recommendation of these proper eating practices, we are doing them. We will continue to do them, and we have been doing them.
Okay, thank you very much. So let's cross over to James before we come back to Joseph. James, my question is about folks driving taxi, the keke. Okay, let's just stop there to taxi and keke. They are happy getting people from one spot to another, but they are in an enclosed space. But what should they do?
Okay, I think this is a bit simple if you look at the new mandate from the government in regards to the compulsory mask wearing is a key to those, especially looking at the question now about drivers and that of passengers. The reason why mask was actually proposed to the public is to actually reduce the spread of the infection. So all I can say is that though it is true that they sit in the same car together, but my greatest advice to them is that let us make sure we wear our mask to save us and reduce the spread. And even in wearing a mask, I want to make it clear that especially the masks of which we use, some are not something that are reusable. But we see that drivers and even passengers, some of them tend to reuse it for 1, 2, 3 days, which is even more harmful to them. So it's something that I think needs to be stressed on, that the mask, especially for the African side being produced, that one is something reusable, but it needs to be washed on a daily basis. So that's exactly what I can say about that, that they should make sure they wear their mask at all times. This is at least a way for now to help reduce the spread of infection.
All right, thank you very much. So Joseph, are you there? Okay, so maybe this question can generally go to every one of us. Like for example, Joseph and every one of us chatting now are obviously conscious, youth, and we all know about the existence of the virus. But what about those who feel invisible, who are not exercising the physical distancing? What's your message to them? So we can start
Yeah,
from
man.
Joseph and
Those that are not observing
feel they
social
are invisible.
distancing, and yeah, like we can see them, but my message to them is that they are endangering their lives, the lives of their families, and every other person who may come in contact with them after their social gathering. Because I see people still sitting at bars. I live in Matadi, but in my community, somewhere back where people believe that they are invisible, there's still clubbing going on. People are still doing things as usual. Yes, I mean,
Was there Pauline?
people are still balling. I see a phone call from a colleague today who wanted me to go sit to ball with them. I told him, I said I don't ball on normal days. So now that I say we should observe social distancing, I will not ball. So it is very important that these people know that you don't know the travel history or the health status of
the 1 or 2 persons you are sitting in close proximity with. They tell you that this thing spread through droplets, and it comes from sneezing, coughing, and even you having very close contact with the person. Sometimes I'm gonna share one Atari cup, one Lego cup together, or share bottles, or the rest of it. You don't know where that person traveled from, who they've come in contact with, what is their health status. So in the absence of those kind of information, it's important that the social distancing rule be applied to all of our daily behavior, because you are not living just for yourself. You are living for yourself, you are living for your family, you are living for your community, and you are living for your country. So if you put the lives of 4 million people at risk just because you want to go and chill, I mean, the message is for them. They should know that people they are interacting with may not physically appear sick, but you don't know whether they've passed, and the virus does not have signs like when you see a person, you see the person haircut will be different, or the person eye will be red, and so on the person. But it's not like that. It's not like a fever. It's not like malaria. You can be in somebody, and the person, maybe the person is a healthy person and still got it, and you get in contact with that person, you get your own trouble from there, and you go and put other people, lives at risk. So it's important that we hear the health protocols, we hear the health authorities, and listen to what the national government they say to make the work easier for us.
Okay. All right. So what's about you, Mr. Momo?
You asked me, but maybe to add on again is that every passenger or driver should see everyone as a suspect. As long as I see my brother or the next man who sits by me in a taxi or keke or on a bike as a suspect, I want to take all necessary precautions in trying to prevent my own self. So that is one of the keys. See everyone as a suspect and take all necessary precautions.
All right. Okay. Okay. So with everyone, every country, and everybody turning on for solution here and there, and I mean, and vaccines are not actually available right now, and we are not too sure it will be available in the next 1 month or so. So I'm wondering why we all can support, why everybody can support Madagascar COVID organics. So we start with Pewee. So that's the controversy about
Thank you
it.
very much.
Let's look at it, the controversial COVID organics.
When it comes to the use of the treatment from Madagascar, there is something that I applaud Madagascar for. I appreciate Madagascar for taking a bold step. I try to get rid of that myth from the minds of the people when I was called, like I think a week ago, by one of the radio stations by around 11 p.m. to give my view on it. And I told them that it is not a cure, it's a treatment. Yeah, because people are still studying the nature of the virus.
Yeah.
Now,
Yeah.
you will only determine the cure of the virus maybe after a year or two by doing prospective cohort studies, and on those who might have been treated with a particular like the medication during this period. So the thing from Madagascar is not a cure; it's a treatment. Until scientifically proven beyond all reasonable doubt that this was effective during the fight, of COVID-19, and it treated millions of people who came down with the virus.
So we
Then
can
we
give it
can
a
consider
try.
to be a cure. But now,
Give it a try.
it is just treating signs and symptoms.
Okay.
It is just treating signs and symptoms. So now, I don't have any problem with the treatment from Madagascar.
Okay.
I'm very, very aware that they might have conducted heavy metal study to identify all of the heavy metals in that plant that they used to consider as treatment for COVID-19. Because once that is not done and the heavy metals are still within it, they can also lead to further complications in the patient. And then you also have to take into consideration the genetic information of those that will be taking the
Caution.
COVID organic from Madagascar, because I mean, just how we have the quinine, the different malaria pills. We have the quinine, we have the chloroquine, we have the amidaquine. Just as they are not, all of the pills are not used to certain individuals. Someone might take the quinine, it might not be okay for that person, and you know the person might all react to it. Somebody might take the chloroquine, it might not be okay for that person. The people have to do further study on that treatment because people have different genes. And then when you are coming to apply that treatment to everyone without getting the sample of their, of their blood to do genome analysis, to do bioinformative risk assessment, and to come up with concluding stuff in making sure that that identical treatment works with the gene of everyone, then I think it is a little bit problem.
Okay,
I
Joseph.
appreciate Madagascar as an African country for the great step taken to come out with this treatment.
Okay.
Some countries have tested the Senegal, they say it is effective. So we are still waiting on other African countries to do more testing. We are also waiting on the WHO to do further testing to know if it is 100% effective. But this is laudable. They can try it in Liberia also on those, because it's a trial stuff. We don't consider it to be a cure yet. It's a trial treatment. So they can try it on our patients there when it is effective. Well, we also inform the world that yes, the treatment for Madagascar is effective and it has worked on our patients, and it has cured all of the patients we have in Liberia. Then I mean, we say that that's fine because Madagascar. I mean, I don't think Madagascar recorded all 200 cases. Since this entire stuff. So it is important to test the treatment in most of the African countries. Let us see the impact, let us see the effect. Then we come out and say, okay, this is effective. So
All
that's
right.
my view on it.
All right, Joseph.
With respect to the Madagascar concussion for treating COVID-19 patients, I don't have much to say because I'm not a medical doctor and I have not read any scientific article on the chemical and the medicinal, concentration of the concussion that Madagascar is using to treat people positive with COVID-19. Holding that, I'm also not against the use as a trial dose because it's traditional medicine. The white man will produce vaccine and call it a trial vaccine. That's synthetic medicine. So if Africans will come up with their own, their own trial medicine, and the white people are now the West is working on vaccines for which they are trying on COVID-19 patients. So why are we talking against our African brothers who have come up with a trial drugs to see the effectiveness in treating the COVID-19 patients? So the tool can be used, and the one with the more weight and faster recovery rate can be adopted for global use. So
Sure.
I'm not against it. I don't know more about it, and I haven't even tested it to see the concentration of it. So yeah.
All right, James.
Yeah, like my colleagues have said, I think the key thing is that we must commend them for the fact that they were able to come out with test or medicine to fight COVID-19. So, bravo to them.
All right.
But the fact remains that from a public health perspective or standpoint is that medication or pill to or need to go through clinical trials before actually being put out for the use to the public. But however, and I've not gotten much information on that yet as to whether the medication being produced went through any form of clinical trials and was approved to actually be used. So I would actually like to rest my case for that until it's approved to be actually used. But I must commend them for now. There's nothing to use, so they are all trying to have this. Others can work it out.
Uh,
But I
uh,
can't say much about it for now.
all right. So on the same thing. So do we have the freedom to try whatever we think work in treating our patients with extreme cases of COVID-19. I'm actually asking because of the of lot of odds against us. Like we heard or we've read in the mainstream media or other network, Bill Gates, other people predicting about the number of people that are going to die as a result of COVID-19. Even a recent week, that Ota, Mote is the WHO regional director for for Africa. And she announced that the pandemic will kill up to 190,000 in Africa in the first year if not contained.
Yeah, those are projections, and these public health experts use existing information to project a certain trend. But that is not 100% certain because things can change with respect to countries' attitude towards the response. Like us, when we started in the middle of nowhere of this whole COVID-19 response. We just had a few testing cases and we're trying to pull our house together. They were hauling and putting about how the management team will be and the rest of it. Now we come together and we are now on par and moving towards and we are actually testing, isolating, and treating now. I think most countries are aiming ahead. Like Ghana got a good containment measures and able to put together all those things. So if we all can exhibit the attitude of social distancing and trying to observe all health protocols, that projection might likely be false for Africa. So it will only happen if all other factors remain constant as per the time the projection was done. Maybe at that time, no social distancing, people are not testing, people are not being treated, there's no good contact tracing done, and the rest of it. There are underlying factors that must sparkle or make that projection true. So if we can change the narrative around for ourselves, starting with us as individuals, we may have that as recorded in history that was projected and it never happened. So that'll be the first time happening.
Okay. All right. So after the worst is over, I think you said you can start out with this question. After the worst is over, our public health system will certainly change forever. But could the fallout also result in changing our consumption heavy lifestyles in ways that could prevent a future outbreak or in ways that will improve the air we breathe? So basically, chat and from there, Forkpa.
No, your audio is muted. Your microphone is muted, rather. Can you unmute your mic?
Okay, now. Are you hearing me? Are you hearing me? Yes. Are you hearing me, guys?
Yeah, I'm
Can
getting
hear
it
you now.
now.
Oh, okay. Yeah, so we are wrapping up. Um so the question was to Joseph, right?
Yeah.
Yeah.
All right, so Pewee, you can start up from there before we wrap up.
Hello.
Hello?
Yeah, you
It's my
getting me right?
Yeah, yes, sure.
Oh, all right. Yeah, I mean, when it comes to the continuing strategies in Africa, especially Liberia, the continuing strategy in Liberia is not enhanced. I mean, I mean, when it comes to traditional containment measures, from the aspect of, personal protective measures, the hand washing is effective in all of our communities, but the wearing of masks, our people do not know how to wear the mask properly. Our people have been told to wear masks, but they don't know how to put the mask on. They don't know how to remove the mask. I mean, this might even lead to the spread of the virus more, because people continue to put their hands to the mouth to take the mask off, to talk. After talking, they put it back. They take it from there again. After talking, they put it back. I mean, the education is not about telling somebody to use something. It's like coming to something in the village. You know, to the people, I mean, this is a combo. And, at some point, the poor will start to draw water from it into drink, because they didn't tell them that, this is meant to, to be used for pooing. So it's a huge problem. And the next thing is the social distancing, avoiding crowding. It is also a major problem in Africa, especially Liberia. Avoiding of crowding. The containment strategies need to be enhanced. And when it comes to detection, isolation, and quarantine, well, Africa is doing well. When it comes to that, as Liberia too is also doing well. Yeah, I mean, the movement restriction, people have not been restricted in Liberia. People have not been restricted. People still go out doing their normal businesses, I mean, up to 3 p.m., as if to say the virus does not spread during that period. The virus can only spread after 3. You see that? From the onset of this thing, we have been alarming that the very first case that came out, the community in which that case was registered, the people should have carried on quarantine in our community and carry on epidemiological surveillance. Then with that, the virus would not spread, but he didn't do that. And from the onset, we continue to alarm this thing every time. I mean, we need proper containment strategies. That is the only way, we'll be able to get rid of this virus. When it comes to the environmental measures, Africa is also trying our best. Routine cleaning, people just need to do a lot of cleaning of the environment and all of that. So we need enhanced containment strategies in Africa, especially in Liberia. So the projection I was giving is just a projection. I mean, projection can be achieved and it can also be achieved.
Okay.
So the projection actually came with an advice to say, if this is not done, this is going to happen. Yes, so I don't see that as a major thing, because just something that someone said, okay, this is going to happen with the trend, and that we're seeing right now. Over 190,000 persons might die from the virus if proper containment strategies are not put into place.
All right. So let's close up with this question, concerning our participation as young people. So why young people should care about COVID-19, and how is it important to mobilize youth leadership during this crisis? So Jean, will you give your take?
Okay. We are the strong men. The youth at this moment, I see them as the strong men in this time of crisis. Our legs are strong to move, to kick the dust and carry on the awareness out there for our people that coronavirus is real. So I must commend, I think when I first started, where I entered several communities, I actually saw a lot of work done by the youth out there, where you see that for every entry point within a community, you see most youth out there trying to show that they restrict the movement of residents or even visitors in and out, making sure that they wash their hands and even doing temperature testing at those various entry points in communities. So I want to commend them for that. And I've been following other entrepreneurs and like my colleague what is Vina, who is in my DB county, that is reaching in some of the remote areas to make sure that he can actually carry on this awareness that our people can be informed of what is happening. So I must say that the youth is actually doing well. The youth is making a serious impact in this particular pandemic. I must commend them and I would say bravo to them. And they shouldn't stop because as Corona exists, we shouldn't give up until we see to it that it is controlled because we cannot actually at this moment eradicate it, but we can have it under control.
All right. Thank you very much. Pewee?
Yes, thank you very much. The first thing in Liberia, I must appreciate the young people. They are doing extremely well. They are doing a great job. It is just that there are so many of them who might not be following the control and and prevention measures when they go out there. And this route, the fact that it travels through the air, it means that moving from door to door and carry on like awareness might not be one of the safest methods. People could try to motivate our people to listen to radio stations a whole lot. It becomes better because people also moving from one community to another. They are high risk. They are part of the high risk population because this virus, the fact that you are out there, you are already at risk. The fact that you are outside, you are already at risk of contracting this virus. Because the virus travels through, droplets. And research have also shown that even through breathing and talking. So all of that, our people, our young people are doing well. And when it comes to this fight, I must appreciate them. Everywhere you go, you see young people at various communities telling you to wash your hands before you pass. They carry on awareness and all of that. People are engaging radio stations. So young people in Liberia, like I said, Liberians are resilient people. We have built up that resilience for several years. Not even Ebola could stop us from damaging our resilience. So that resilience that we have continues to live on. So even now, our people continue to understand that it is resilience that continue to make us to overcome these things. So young people are excellent. They are doing extremely well. What we need to do is that I think this thing, the other one should be set up for maybe another discussion.
Sure.
When it comes to motivating young people to achieving careers, because you can't advise young people to focus on their studies, to go in the sciences and other places. Then when they graduate and should be occupied, take the jobs and give it to politicians. And then you continue to motivate the people. I consider that to be a complete lie. You're lying to the people. You can't tell the young people go do science. Then when they come back, you don't have the ability, to follow, enhance, and strengthen their capacity when it comes to career advancement. You seen it? So
Okay.
no experience, nothing. So the young people are doing well. I must appreciate them.
All right. Thank you very much. So let's come back to Mr. Charles. Joseph?
He's out. Joseph Charles is out. He got meeting at Joseph Charles got meeting 6:30.
Okay, all right. So, gentlemen, it has been a pleasure having you guys here. So, I'm hoping we can meet here again. Again to have another interesting conversation. So, thank you very much, and thanks to our
Yeah,
many
thank you. It's a
viewers.
pleasure.
Yeah, thanks to our many viewers for also viewing and sharing. My guests have been Mr. James Momo, Mr. Forkpa Pewee, and I'm Krua, your host. So we want to say thank you so much. Guys, it's okay. We can let you now or you let.
All right. Thank you. Thank you very much.
All right, thank you very much.
Look,
Yeah, thank you. It was interesting, man. Yeah, I hope we can have enough conversation again.
yeah, my man.
Yeah, thank
So
you.
when you living up,
Man, the whole level just holding people here, but I'm supposed to be different next
tell
year.
you,
Yeah, next year, man.
oh,
And now we still in nothing going on. Everything crazy. From
but there's no
December.
online. You book, how about online? Yeah, you book doing your
No,
online too.
I'm not doing any on I mean, I'm not doing any level in classes. I'm in laboratory. So
Oh
that's the
no, but
thing.
then forget that you need to be there. It's new part
Yeah,
of the process.
yeah. So that's actually the thing. But hopefully things will get better. We are praying it gets better soon.
But it's actually good on the process platform. I actually teach with it. So at least look forward to interacting beyond this and then trying to make it collaborate in time to time.
Sure. Yeah, that's why the platform is here. Like, I mean, yeah, just invite people. We talk sounds and yeah, that's our area. We can't do anything with it. We can't go do the
I will try
politics.
to keep in touch.
Okay. All right. Thank you very much.
No, I'm not talking about that. That's why I thought, okay,
All right, bro. Thank you very much. It was a pleasure having you.
you too.
Okay.